I am Dr. Sridhar. The picture you are seeing on your screen just now is not very palatable. Unfortunately, it's a nappy of a baby with stools. You can see two different changes in the stool. Obviously, the stool is green. I mentioned earlier that green stool in itself is not a concern. Many babies with more rapid gut emptying can have green stools, and that pattern can change from time to time. We also see mucus in the stools, and mucus can be a reasonable common variant depending on the diet and depending on the rapidity of movement. So mucus secretions are part of the intestinal secretions, and if the intestine moves quickly, the mucus may be there in the stool. But a lot of mucus, a diarrheal stool with mucus, and the blood speck that you're seeing there makes you wonder, is it normal or not? So if the child is an otherwise healthy baby who is exclusively breastfeeding, this happens suddenly, or the baby becomes irritable and starts to refuse feeds or has severe reflux and so on associated, we start thinking of milk protein intolerance as a primary factor. Egg allergy, seafood allergy also can overlap, so we usually eliminate the cow's milk protein as a commonest factor. And I have explained before that cow's milk allergy can happen in exclusive breastfeeding babies because the protein can come through the breast milk. The mother is taking the cow's milk products herself. So when we have a breastfed baby coming with these symptoms, the treatment is to avoid the products, all the dairy products in the mother's milk, mother's intake. And obviously it takes 1 to 2 weeks for the response to happen because the inflammation is taking place in the tummy, and that's why you see this change. And once the protein is eliminated, the inflammation heals, and that takes 1 to 2 weeks. So you don't expect an immediate response. Of course, there will be improvement in 3 to 4 days, but mucus and a few blood spots can continue for 10 to 14 days. If the baby is on formula feeds as well as breastfeeds, the mother has to eliminate from her diet the dairy products, includes milk, yogurt, cheese, butter, ghee, everything like that. And even the biscuits and things which contain milk may have to be avoided. Full elimination in a diet. Plus the milk product that we use for milk allergy is different. We have extensively hydrolyzed formula or amino acid formula or the hydrolyzed rice based formula. So these are the 3 products that can be used in milk allergy, and these are relatively expensive. The rice based one is the least expensive of the lot, and obviously you have to discuss with your doctor which suits you better. The taste is not as palatable for the amino acid formula and the extensively hydrolyzed one. Some of them come with thickeners because most of these babies have reflux as well. If you don't think it's allergy and this happens during intercurrent infection, like for example the baby has bronchiolitis and this mucus and blood comes, mucus in the stool and the changed pattern of stool like runny stools can happen with any viral infection. If the patient is on antibiotics for any reason, that can change the gut microbiota, that can bring mucus and green stools as well. However, the blood in the stool can happen in this situation if the mother is doing suction of the nose, because the irritation of the mucous membrane causes the blood to leak, and that can be swallowed by the baby, and along with the increased gut emptying, the stool can have a speck of blood. So if it keeps happening, you have to worry about it. In constipation, you get a streak of blood and hard stools, not like this. So if the child is constipated and is straining to pass the stools, you may see this picture as well. But there the stool is hard, the straining and the less